All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Hello dear friends, good evening. We are back with yet another episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. This is a talk show with the doctors of Al Hilal hospitals and medical centers. Today we will be discussing about oral hygiene in children, and we are delighted to have with us Dr. Tabassum Taib from Al Hilal Hospital, Rifa. She is a pediatric dentist with an experience of more than 14 years, and she has published many articles in pediatric journals. So, Doctor, welcome to the show.
Thank you, Jasila. How are you?
I'm good. Thank you for joining us today.
Thank you for having me.
So, Doctor, today's topic is oral hygiene in children.
Yes.
So, what age group visit the pediatric dentist?
I see anyone from 0 years to 14 to 15 years of age.
So, Doctor, when should I take my child for the pediatric dentist?
Ideally, the first visit should be when the first tooth has come into the oral cavity, and so there's an age range. It comes between 8 months to 10 months. If there is a delay beyond 10 months, that warrants a investigation. You should visit your pediatric dentist.
And what are the issues parents should anticipate in the first visit?
So during this stage, this is a routine dental examination. So the dentist or I will look at the child from a developmental and not pathological perspective. So the focus is on the timing of the teeth that should be coming into the oral cavity and the age at which you bring in the child. So we will check for age appropriate teeth to have erupted in the child's mouth. So this is the main focus of your dental examination. What you should be expecting is what will we do? We will just do an oral examination. So I'll introduce a mouth mirror into the child's mouth. Under light, we will do a quick examination. The challenge comes, I'll separate it into two categories. If it's an infant, the challenge comes in, we ask the parent to sit on the chair in a particular way, hold the baby in a particular way. So this can be challenging. So just listen to your instructions given by your dentist and nurse. And if the child fusses, don't worry. And if it's an elder child, like 4 to 5 years, they may be coping mechanisms may not have matured in a child. So they are uncooperative, they're moody. They may not open their mouth, they may not be willing to sit on the chair. So I advise parents not to get frustrated or anxious. It's always good to reschedule an appointment if it is going beyond 20 minutes and you're not able to do a dental examination. Because the focus here is the child being comfortable and discussing with your pediatric dentist what you should anticipate as far as development is concerned, because we are going to discuss topics like what is good food to eat, what is good hygiene practices, which toothbrush, which toothpaste to use. So the focus is on the discussion, right? So reschedule if your child cannot cope with the dental visit the first time.
Dr. We know that when the child develops teeth for the first time, there may be pain and many other symptoms. And what are the other problems the child faces during teething?
Okay, teething, this is a common problem. It gives a lot of anxiety to parents. The best way of relieving teething pain is if you give them solid rubber rings or even a damp washcloth to bite or chew on. Do not give them fluid-filled rings, as there is a risk of it rupturing and the child ingesting the fluid. This is recommended, I recommend this for babies who still haven't got any teeth in their mouth. For children who have a few teeth in the mouth, I recommend chilled carrot sticks or apple or celery sticks, but always monitor a child when you're giving anything in the mouth for them to chew on. Teething gels I don't recommend because it's unnecessary use of medication and sometimes it can also lead to toxicity, so avoid teething gels. And also do not give them teething biscuits, as that is not advisable either. There can be some choking if they accidentally bite on the biscuit.
Doctor, another common query from our viewers is around what age the baby starts brushing his teeth?
Right. So if you see, as soon as a child is born, we clean it up, right? We give it a bath. So hygiene is a very important part of a baby's life from day one. Same thing goes even for oral hygiene. It is a part of overall hygiene. So the ideal time to start cleaning the child's mouth is after their first feed, whether it's breast or bottle. So once you've finished feeding the baby, use a damp washcloth or wipes and clean the upper and lower gum pads. Once teeth start erupting, say 2 to 3 teeth in the mouth, you can transition either to a finger brush or a soft bristled toothbrush. So that's when you start brushing.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready to eat foods, dairy products, grocery, or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
So doctor, in the market, there are so many toothpastes are available with fluoride, without fluoride, herbal, so many things. So what type of toothpaste you suggest for the children?
For infants, when teeth haven't come, the best cleaning material is water. Use the washcloth moistened in water. When teeth have come into the oral cavity, say 2 to 8, you can start off with a non-fluoridated toothpaste. This is because the swallowing mechanism hasn't matured in children this early, so they're not able to spit. So if they swallow the toothpaste, it's okay because it's not fluoridated. Once your child has mastered the art of spitting, then you can shift him to a fluoridated toothpaste, 500 ppm, and instruct the child to spit and not rinse after brushing. This prolongs the protective effect of fluoride on the teeth. And the main reason for using toothpaste is for its cleansing and detergent effect. So it really doesn't matter what toothpaste you use. Any brand is fine. So we don't recommend any specific brand. It depends on what brand you prefer, what flavor, and of course the most important thing is the fluoride content. The toothpaste that are not recommended for children are medicated toothpaste, which are used for sensitive teeth, and also cosmetic toothpaste, which is for whitening. These are not meant for children.
And what other oral hygiene products you suggest for children, apart from the toothpaste?
So as a child is growing, initially you will see spaces in between teeth, but as the jaws grow and all the teeth come into the mouth, the gaps between the teeth close. Once you observe that the teeth have no gaps, you start using floss, dental floss. This is to clean in between teeth, because the highest risk of developing cavities in children is in between teeth. So using dental floss is a good idea. And also the tongue harbors a lot of oral bacteria. So cleaning the tongue also is extremely important. You either do it with a toothbrush itself or you use a tongue cleaner. It's up to your convenience. So this should be also a part of your oral health care arsenal for your babies.
Sometimes parents complain about bad breath in children.
Yes.
What do you have to say about that?
So bad breath is normal. All of us wake up with bad odor early in the morning. This is because, in the night there's less saliva, so it's not washing the mouth, and bacteria get a chance to act during the night. But once you wake up and you brush, this malodor usually goes away. So in spite of brushing, for those children where the bad breath or halitosis is not going away, there is a cause for concern. This is usually because either there is cavities in the mouth or there is oral infection. So please do take your child to visit a pediatric dentist for bad breath.
Okay. Apart from the oral hygiene products, what do you suggest for the children to prevent tooth decay and having cavities?
So I said toothbrush, toothpaste, dental floss, tongue cleaners. These are products which come under home care for oral hygiene. We also have services or products which are called professional products. This is mainly fluoride and sealants. So fluoride is something which is available either as a solution or a varnish. We apply it on teeth and it can be done twice a year or 4 times a year. This depends on the dentist assessing your child's cavity risk status and accordingly recommending how many times you would require it in a year. Again, when I say fluoride, it's not a magic pill. This is just merely an adjunct to your oral hygiene practices. Oral hygiene has to be practiced every single day, twice a day, and fluoride just helps to make your teeth stronger. Apart from that, for children who are 6 years and above, when their first permanent teeth, which is their first molars, we call it 6-year molars, when they come out, they are very prone to picking up cavities because they are under that chewing surface. So the child finds it very difficult to access these areas with a toothbrush, and this is where food gets accumulated and gives a chance for bacteria to act and cavities to form. So to prevent this, we have something called Pitt and Fisher sealants. A sealant is nothing but a resinous material which we flow in the chewing surface into deep grooves which are present on your permanent molars. So once we seal it with this resinous material, food cannot go and get lodged in these deep areas. It gets lodged on top of the sealant, and it's all right if the sealant gets destroyed, at least the tooth is saved. So do visit your dentist and ask them more information about sealants. This is another very effective way of preventing cavities, especially in permanent teeth.
Okay. Now, Doctor, what is your message for our viewers who are the parents of young children?
Raising children is challenging, and we're inculcating so many good healthy habits right from a young age. So you're teaching them how to keep their hands clean, their bodies clean. So you're telling them how to wash their hands after every meal or when they come from play, washing their faces, bathing every single day. Same way, incorporate oral hygiene practices also as part of, it's a package deal, as part of hygiene for your child. So I encourage them to start early, start young, and start brushing twice a day. That would be my message for young parents.
And Doctor, how often should the child visit the dentist?
If the child has no issues and the child has a good healthy dentition, then once in 2 years is a good time to visit your pediatric dentist. But if your child has picked up cavities, has undergone some treatment, then every 6 months it is good to visit your dentist, because children pick up cavities very, very quickly.
Yes.
So 6 months is a good time, unless your dentist has told you a shorter follow-up time.
And finally, what do you have to say about Al Hilal Healthcare Service?
We have pediatric dental services available in Al Hilal at 3 branches, at Rifa, at Adliya, and Muharraq branch. We handle children from, like I said at the start, 0 to 14 years of age. We see all children, all age ranges, and I provide services like cleaning, fillings, extractions, root canals, crowns, habit breaking appliances, and so on. And a service called doing full mouth rehabilitation under general anesthesia is also available at Muharraq, which is a hospital. So yes, for those children who are uncooperative, who require extensive dental treatment and are not able to sit on the dental chair, this is a good option.
And Doctor, can you please tell us about your timing at the Rifa branch?
At Rifa, I'm available from 1 a.m. to 9 p.m.
Okay. Thank you, Doctor.
Thank you so much for having me.
Thank you.
It's my pleasure. Thanks.
It's our pleasure also. So viewers, I hope you got all the information regarding the oral hygiene in children. For more informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jasila Mujib signing off. Good night.